Good afternoon. Thank you, Governor. Thank you for your leadership as well. I want to once again thank all of the dedicated women and men of the Rhode Island National Guard who have been doing a tremendous job and are going to be stepping up once again to get the new policies that the governor has discussed in place. To talk a little bit about the cases, as she has mentioned, we have 33 new cases. This brings our total case count to 165. As we have been doing, we will share more details in our afternoon press release. But to give you the high-level view, we know that at least 10 of these people are in their 50s. As we would expect, we're seeing more cases in the more populous communities in the state. This continues the trend that you saw in the press release yesterday with the data that we shared by cities and towns. We indicated that many more cases in Providence are occurring than elsewhere, and other cities like Cranston and Warwick have a number of cases as well. While we're still working to increase the number of people we can test for COVID-19 the way the governor shared, we know that the virus is clearly here. I want to really emphasize this point. The numbers that we are reporting for cases, we know are not reflective of all of the cases that are out there. Because of the supply and process elements that the governor laid out, we are prioritizing certain groups that we know absolutely need to be tested. Our hospitalized patients, our healthcare workers, and our congregate living setting residents, like nursing homes. Because of that, we recognize that there are other cases that are out there, and that's why it's so critical to follow the recommendations that we have been giving and that I will review again. I want to make sure it's understood that the aggressive community mitigation measures that we are taking are because we know that there are cases that are existing in our community. Regardless of whether or not a test is obtained, the treatment is the same. And the more everyone can follow the quarantining recommendations that are being made, the importance of staying at home, supporting seniors and those with underlying health conditions so they don't have to leave the house to go get groceries and others, the more everyone can participate. Staying home if you have symptoms is critical to helping stop the spread of this virus in Rhode Island. If you develop symptoms of respiratory illness that is consistent with COVID-19 that we've been talking about, cough, fever, sore throat, difficulty breathing, it can look like the flu, it can look like the cold. Whether or not you have been tested, you need to stay at home and continue to safely recover there. That's what we refer to as isolation. Even if you have mild symptoms that seem like a cold, you need to be self-isolating right now, doing it safely, doing it at home. We've talked about how if you have other people in the home, you can stay in a separate room, use a different bathroom, take turns with one kitchen, not going in the kitchen at the same time that someone else is there. That is the best approach to being able to stop the spread of this virus and any of the respiratory viruses that occur. It is critical for you to stay at home until all of your symptoms have resolved for at least 3 days, and that's without taking any medications to prevent fever or other symptoms. Most people who have symptoms of respiratory illness will be able to stay at home and will be fine. That's where we need you to be. If you think you need medical care, call your doctor. The shortness of breath is worsening. or you're coughing or have a fever that's high enough that's concerning you because you're not able to drink fluids the way you need to, please call your doctor. But the key is to pick up the phone and call and not to show up. If you don't have a doctor, call a nearby urgent care center. Again, the key is to be able to call and not just show up at a healthcare facility. We want people to get the help that they need while coordinating it to make sure that we also protect our healthcare workers. If you have symptoms of respiratory illness that I've been describing that seem consistent with COVID-19, you should be staying at home, and it's important to know that the people you live with or the people you have been in close contact with while you were sick should also stay home. When we talk about quarantining, that is for people who do not have symptoms but should stay home and monitor themselves for symptoms. This is something we're saying across the board. Everyone in Rhode Island should be doing this and not actually leaving to go get essential needs if you are actually quarantining. Then you can have someone do that for you. Keeping people home who are sick with COVID-19 or who have been directly exposed to someone with symptoms that can be consistent with COVID-19 is the best way to keep this virus from spreading. So the recommendations that the governor shared today of people traveling from New York, what has been shared about people who have had domestic travel by plane, what we will continue to share in coming days, all center around being able to stay home and monitor yourselves for symptoms. The more everyone follows this and takes it seriously, the better off we can be. I also want to address something that came up yesterday. We got asked about restaurants and how social distancing is happening there. People should not be dining in at restaurants in Rhode Island right now. That is clear. For staff at restaurants, groupings should not be larger than 10, and all people should be doing whatever they can to keep roughly 6 feet apart. We understand that can be challenging in some very small kitchens. There may be times when people get closer than that 6-foot distance, but we need to make sure that that time frame is limited, and we need to make sure that restaurants are implementing the requirements that all employees are screened for any symptoms of illness every day and should be alert for any signs of illness in the workplace. We are going out to restaurants every day to help enforce this message to owners, managers, and staff. Last week alone, we went to more than 100 restaurants, and we're keeping that pace this week, and we'll continue to return and support them as often as we need to. We want to thank restaurant owners, managers, and staff because they are being extremely vigilant. They are partnering with us in this response. We are grateful for their partnership. They are just one of the many groups of people who are making tremendous sacrifices at this moment. And that is exactly what it takes for all of us to get through this together.